Hello everyone, this is me Ahmed Kanimazi. I'm a junior at College of Nursing in Rehan University, Dhaka. Today I'm pleasure to be with you again in a new tutorial about two topics including the basics of vital signs for nursing students, and as well as we will talk about the techniques of preparation and presenting seminars and workshops, especially in front of a large audience such as students or like conferences. Firstly, we will briefly talk about vital signs. Firstly, vital signs as a basics, we can say vital signs are like essential indicators of a patient's physiological status, and like these vital signs helps to assess their overall health, and we as nurses should routinely monitor these signs in order to detect abnormalities and like guiding for treatments. We have four main vital signs, which I think every one of us know. What are they? Firstly, we have the temperature, and we have the pulse or heart rate, we have the respiratory rate, and we have the blood pressure. Each vital sign has a normal range and a purpose as well. For example, the temperature, its normal range is from 36.1 Celsius degree to 37.2 Celsius degree. And the purpose of the temperature is to detect fever and infections and like the hypothermia. And the pulse rate, the heart rate, the normal range is between 60 beats per minute to 100 beats per minute. And the purpose is to assessing heart function and circulation. And the respiratory rate from 12 to 20 breaths per minute. And the purpose of the respiratory rate is to monitoring breathing efficiency and lung function. And we have the blood pressure. Usually the normal range is being between 19 on 60 to 120 on 80 mercury millimeter. And the purpose is to evaluate the cardiovascular health and the circulation. And also we have some additional vital signs, including the SpO2 or the oxygen saturation, and we have the pain level and the capillary refill time, and like the blood glucose level. Also, each one of these vital signs has a normal range and a purpose. Normal range of the oxygen saturation is usually being between 95 to 100%, and the purpose is to assess oxygen levels in the blood. And we have the pain level. We get like a subjective scale from 0 to 10. We measuring it usually by like open-ended questions with the patient, like when we telling the patient to describe how is the pain intensity, and the purpose of the pain level is to like measure the pain severity in order to manage this pain. And the capillary refill time, usually it should refill in 2 seconds, and this one is being done to like indicating the peripheral circulation efficiency. And the blood glucose level, it's usually the normal range being between 70 to 140 milligram on deciliters. Depends on like fasting, because like when we talk about, inshallah, later about the diabetes, you will know what I mean by fasting, and the glucose level is being done for like monitoring the blood sugar level for the diabetes management. And now, after we have mentioned the main vital signs and the additional vital signs, now we have something else, which is how to measure vital signs properly. Like each vital signs has a way to measure it, or has a tool, a specific tool. So when we talk about like a temperature, so we have the thermometers. We can use it like in oral or in the axillary, or like the tympanic in the ear, and as well as the rectal for like the neonates. And we have the pulse. The pulse rate usually being measured at the radial and the carotid. The radial is in the wrist of the hand, and the carotid is in the neck. These arteries like being measured for at least 60 seconds or 30 seconds, then multiply them. The respiration, count to breathe, like we count breathing by using sights, or even we can putting our hands on the patient's chest and like calculating a breath, counting them like for 1 minute. But it's better to let the patient not noticing what you're doing. Okay, like when we usually doing the respiratory rate, when we counting breaths, we avoid to make the patient notice that. And you have the blood pressure. As known, we use the sphygmomanometer and the stethoscopes. And now in the emergencies and in most of hospitals, in the triage unit, there's a electronic blood pressure monitor, and there's many types of the sphygmomanometers. We have the mercury, we have the electronic, and also we have the aneroid. Each vital signs has abnormal findings, like in a low value and high value, and it has a causes as well. For example, if we talk about the temperature, like we have in some conditions that the temperature is being low value, the hypothermia, the shock, the prolonged cold exposure, and we have the high value of the temperature, including the fever, infections, and like the heat stroke. And about the pulse, usually the low values of the pulse rate, like one of the causes is the bradycardia being below 60 beats per minute, and some medications affect heart block and the hyperthermia as well. And in high values of the pulse rate, we have the tachycardia, which being above 100 beats per minute. Also, we have the fever, dehydration, anxiety, and some of the heart conditions. About the respiration, we have the bradypnea. But the bradypnea is being defined as 12 or less than 12 breaths per minute. This is the bradypnea. And some drug overdoses, when patients take overdoses, it may cause the low value of the respiratory rate. Other conditions in a traumatic, like the brain injury and respiratory failure. The respiration also has a high values. The most causes of the high values of the respirations, including the tachypnea, which like usually being above 20 breaths per minute, the anxiety as well, lung diseases, fever, and sepsis. And about the blood pressure, low values usually we have some causes of the low value of the blood pressure, like the hypotension. It's usually below 19/60. The shock, as like it's one of the causes of the low value of the blood pressure, dehydration, and the blood loss. And the causes of the high value of the blood pressure, we have the hypertension or the silent killer. It's usually being above 140 on 90. And we have the stress is causing high value of a blood pressure as well, kidney diseases and cardiovascular problems. The oxygen saturation usually being below 19%. One of the causes, we have most causes. One of them is respiratory failure, and we have the some lung diseases. Inshallah, you will learn it in the future. And high values of the oxygen saturation, like it's nothing. There's nothing available till now, or we can say normal values are very rarely exceeds the 100%, but we have low values. Also, we have a clinical importance of vital signs, like why measuring vital signs is important. We can say the early detection of life-threatening conditions such as like shock, sepsis, and stroke. And also it helps in monitoring treatment effectiveness, such as like response to medications. It guiding the medical decisions, like when we decide this patient need oxygen therapy or IV fluids after we checking the vital signs. And also it's essential for triage in emergency settings.